So watch this video until the end if you are 50 or older and still ignoring your prostate. I am a urologist and pelvic surgeon, and today we're going to talk about why you should not ignore your prostate. If you're new here, I am a urologist, and I talk about all things sexual education, bladder health, kidney health, and much, much more. So make sure if you like what you see, you share this with your friends. The prostate is a walnut-shaped gland that sits underneath the bladder, around the P-tube, or the urethra. And it makes up about 80% of the seminal fluid, or the fluid that ejaculates with semen. It's a very important part of the male anatomy. And as men age, specifically over the age of 50, they start to develop what we call benign prostatic hyperplasia. What is that? That's essentially an enlargement of the prostate, and as the prostate enlarges, it can cause symptoms. These symptoms include things like difficulty emptying your bladder, straining, intermittency, like starting and stopping, and sometimes even a sensation that you have to go or that your bladder isn't empty. Sometimes it can cause decreased flow or a really strong stream, and rarely will it cause kind of a spraying stream. But these are all symptoms of an enlarged prostate. If you're having these symptoms, you may want to see a urologist to get evaluated. We can do a number of tests to evaluate you. The first is a physical exam, and that involves a digital rectal examination. Some people call this a prostate exam. And what I do during this exam is I feel for the size and the shape of the prostate. Is there an area that's kind of hard and irregular that might be a sign of cancer? And also, am I able to feel the edges of the prostate? Normally, the prostate should feel smooth and shouldn't extend more than 2 to 3 fingers wide. If it does, that could be a sign of an enlarged prostate. Other tests that we can do include a urine flow test, which is a simple test where you just urinate into a device that will measure how fast and how much urine you're able to empty over time. And this is a very easy test that can be done in the office. Other tests include things like a post-void residual. What is that? That is when you urinate, and then we use ultrasound to measure how much urine is left over in the bladder. Typically, you want less than 100 cc's, or 100 mLs left over after you urinate. If you have more, that could be a sign that you're not able to empty your bladder completely. Lastly, we can do a cystoscopy. A cystoscopy is when we look inside the bladder through the urethra using a cystoscope. And we can look and see, is there any obstruction actually blocking the flow of urine from getting out of the body? And this is usually only done if the other tests aren't helpful or aren't available. So once we determine that you have an enlarged prostate, what can you do about it? Well, luckily, there's a lot of great treatment options. The first is you can undergo what's called a prostate biopsy. Prostate biopsy is a procedure where we take small samples of the prostate to look at under the microscope to see if there's any signs of cancer. If you have an enlarged prostate, you don't necessarily need to get a prostate biopsy unless you have symptoms that suggest cancer, such as really any new urinary symptoms, blood in the urine, or if your digital rectal examination findings are abnormal. There's also a number of medications that we can use to help improve symptoms related to an enlarged prostate. Some of the first-line treatments include things like tamoxifen, Flomax, terazosin, alfuzosin, doxazosin. These are medications that we call alpha blockers, and they work by relaxing the muscles around the urethra so that urine can flow more easily. Other medications that we can use include PDE5 inhibitors. This is a class of drugs that's typically used for erectile dysfunction. So you may hear the brand names Viagra, Cialis, Levitra, Stendra. These medications can also be used for men who have lower urinary tract symptoms or symptoms of an enlarged prostate. And lastly, there's a class of medications called 5-alpha reductase inhibitors. These medications include finasteride and dutasteride. And what these medications do is they reduce the size of the prostate. They won't reduce the size immediately. It takes a few months for them to start taking effect. If you have tried medications and they're not working for you, there are other treatment options. There are a number of treatments available now that don't involve surgery. One is called UroLift. And what UroLift is a device that's inserted into the urethra and lifts up the prostate so that it allows easier flow of urine. Another option is called Rezum. And what Rezum is a laser that we use to vaporize or remove some of the prostate tissue. And lastly, there's aquablation, which is a combination of a laser and water that we use to remove the prostate tissue. All of these are good options if you've tried medications and they're not working for you. So please don't ignore your prostate. If you're having symptoms, make an appointment with your primary care doctor or a urologist and get evaluated because there's a lot of great treatment options. As always, remember to take care of yourself because you're worth it.